Well, 21 minutes past 6. It's a bank holiday today, but if you've ever tried to book an on-the-day appointment to see your GP recently, you may well know how difficult, how frustrating that process can be.
Government is announcing plans to tackle the issue tomorrow. Some of the details, though, have already emerged, including £240 million for GP practices to improve their phone and online booking systems. Let's get some more details on how that might work now with our Dr. Nigat Arif. Morning to you, Nigat. Lovely to see you this morning.
Morning.
And this is something I think lots of us will know all about, trying to get a doctor's appointment and that moment, you know, having to set your alarm, be on your phone at the right time. It can be really tricky for patients and very challenging. And I know challenging for people working in GP surgeries too, can't it?
Absolutely. And I've got that double role where I'm the GP on the other end, because on Monday morning, Sally, I'm usually duty doctor at my practice, taking in all the emergency calls and seeing routine patients. And I've also been that member of the public as well on the other side, trying to book that appointment on a Monday morning for my loved ones or my son or etc., because it is so difficult to get through to the phone. So this is a welcome, well, it's lovely. It's good news to have a bit of good news at the moment.
So we're saying that the government's plans will encourage more GP surgeries to embrace the latest technology. What difference will that make?
So it's really important that as viewers of BBC Breakfast, we look past some of the headlines. Some of the things that they're saying at the moment is that we're going to implement, as you were saying, telephone lines. We're going to have better technology in order to make sure that patients have better access to their GPs. But looking past the headlines means this isn't going to be embedded quite quickly at all. This is going to take quite a long time. General practice at the moment, morale and burnout is huge. We are exhausted, and also we don't have enough retention of staff at the moment. Getting more phone lines is fine, that's okay, or giving us £250 million is okay. We need that investment, but actually we need that investment a long time ago. In 2019, we were promised 6,000 extra GPs. Now, 825 GPs less at full-time who are not working. And in some patches, Sally, we've got 250,000 patients per one GP. And that means that the demand is so huge. And so giving us telephone lines is okay, but who is going to man those telephone lines? Where are going to be the receptionists? Because we're getting so much of the receptionists also leaving because of high frustrations and also the abuse that some of our front of house colleagues face. I'm hearing some horror stories over the whole of the UK, and some colleagues who are sharing those stories as well. They're just finding that they just don't want to stay in the job. And I think that's where fundamentally we also need to be looking at, other than just technology, because we are really, really tired in general practice.
It's a tricky moment, isn't it? Perhaps if you've been on hold, waiting to speak to a receptionist at your GP surgery, desperate to make an appointment for yourself or for a loved one, what is your advice to people who are in that situation, maybe getting quite stressed about it, talking to a receptionist on the other end who is also very stressed? What's your guidance to us?
Firstly, I would say that there are other avenues as well. You can always go to your pharmacy colleagues as well, and they can give you simple advice. And I know that you've got Thoran on later, who's going to be talking about this. You've got allied healthcare professions. It might be that you need to see the physiotherapist, and some patients are going elsewhere. It could be 111 as well. And also, if it's an emergency, then it could be the A&E team as well. And it's really hard sometimes to make that judgment. That's why getting a conversation through 111 is okay. Now there's also 111 online, so you can be given advice in order to signpost you in the most appropriate way. It's so frustrating being on that phone and holding on. And I completely, as a GP, understand that. As I was saying earlier, I've been that member of public on the other side as well, trying to get through. And this is where I think that we've got to be really sensible. And the viewers of the BBC know that actually having headlines such as giving a GP recovery plan is fabulous, but where are the actual implementations and the logistics behind that? The difficulty is that GPs like us, we are bereft for our patients, because we don't want to be having these headlines where patient satisfaction is so low, or a patient is waiting on the phone line, getting really frustrated, trying to get through to us, because that means that we're not doing our job properly. And when we're working so hard to try and make sure that we're meeting demand at a time when we've got a 6% increase in complexity of cases, and it's not just that the patient then comes to us and then getting through that phone line, Sally, it's about then where do I go with secondary care when I know that the wait line in secondary care is huge. So for a hip replacement, it's 18 months. If you're referring for a routine gynae appointment, it could be 6 to 9 months. So if you've got a woman who's got endometriosis or menorrhagia, you could be waiting for quite a long time. If you want to do a musculoskeletal referral, you're looking at 3 to 6 months, depending on the area that you're on. And I'm keeping patients held in primary care, and I can't, as a GP, hold them for long enough. And that's not just my story, that's every other GP story in the UK. And in the pandemic, for 2 years, you saw me here on Monday mornings talking through the pandemic, talking about vaccines, how we're implementing vaccination programs, how we're keeping our most vulnerable really, really safe. And we did all of that work in primary care. And currently, on the other end, when we're trying to make sure that we're keeping retention of staff, we're trying to make sure that there isn't low morale and there isn't burnout, we feel that we're abandoned completely as a healthcare professional in primary care. And that's just getting pharmacists on board as well is fabulous, but they're also in a similar situation because getting the amount of work that we're getting through is just so difficult. This is just year on year for a long time underinvestment within primary healthcare. And if primary healthcare fails, I'm afraid that the NHS will fail. So we need desperately better plans on how we're going to keep retention of staff and how we're going to manage morale and burnout.
Nigar, I know this is something we will be talking about a lot over the next day or two. Thank you so much for your input this morning. We will put all of those points to the people we talk to tomorrow from the government about this new plan.